Good morning, everyone. My name is Greg Miller. I'm one of the partners here at ASURA Risk Management. And first of all, I just wanted to say thanks so much for taking an hour out of your day to go through this 2021 risk management planning as it relates to COVID-19. I think we can all agree 2020 created a number of kind of unique challenges, and one of the biggest questions that we get is, where do we go from here? How do we manage through this? And I'm confident in the next hour you'll leave this webinar feeling prepared to kind of manage exposures, comply with new legislation, and be better equipped to bring employees back into the workplace. So ESM, they're a partner of ours, long-term partner of ours. Anthony, Sinead, Sarah, we appreciate you guys spending some time on the call with us here. And I'll let you guys kind of take it from here. But again, thank you guys all for hopping on the call, and I'm sure you'll find this to be informative. And please feel free to buzz in and ask any questions either during the presentation or after. So Sinead, Sarah, take it from here.
Thanks, Greg. So we are thrilled to be here today to go over some next steps. Of course, like that intro slide, we are wanting to look at 2021 as a way for us to move forward. A little presentation housekeeping after I introduce who we are. So I just want to let you know I'm customer success at ESM Insight, and my primary role is to work with our clients, get them onboarded into our Insight portal, and much more. I'm joined here today with Anthony Poston. He's our CEO and expert in risk management, and the two of us will do a deep dive on the new OSHA regulations as well as much more. So presentation housekeeping, like I promised, you are all muted. If you were listening beforehand, we were as well, but we got things going. This is a workers' comp focused webinar. We are going to go over safety and Cal-OSHA compliance. There are so many resources that we are going to share with you throughout this presentation, and you can use them as a framework for your COVID risk management. Anything that you see as far as a resource, as if there's a link on the bottom of the slide, check your chat box. I'm going to be sharing those links live with you real time. And then at the end, after this presentation, you will be getting a copy of the PDF. We get asked that a lot about copies. So you'll get a full copy of this presentation, and we're also recording it. So this recording we will send to our partners at ASURA Risk, and they will be sharing it with you all afterwards. If you do have any questions, like Greg was saying earlier, definitely use our chat box as a way to ask those questions. We'll try to answer them throughout the presentation with the material alone, but if there is something specific that we can't address, we'll definitely reach out afterwards to answer. So we are now number 9 as far as our webinar series goes. I cannot believe we are in December and we are still navigating through this pandemic journey. And it truly has been a journey, twists and turns and lots of different changes that all of you are experiencing in your organizations to become compliant and make your workplace as safe as possible. What started in March as something that was temporary has now become our new normal. And this slide always amazes me that we have come this far and it's been this long. But we're now in December, approaching 2021. And today we're going to go over the new Cal-OSHA regulations and also look at 2021 planning as far as it goes with your safety management side. This is today's topics or agenda for today. We are going to go over the Cal-OSHA COVID regulation 3205. Anthony is going to do a deep dive into that to get you brought up to speed on those new regulations. We're going to be looking at AB 685, which is coming up January 1st. So we did have a webinar, if you were on it last month, going over the Senate Bill 1159 and touching on AB 685. So we'll be looking at that. We have some great travel guidelines and resources with the holidays approaching. And then we'll be looking at risk management planning for 2021 and giving you lots of resources to get started or revamp any existing programs that you have. And then at the end, we'll be looking at the new features as far as Insight and what we have going. So a lot of great material today. It's going to be a full hour. And before I turn it over to Anthony to go over the new regulation for 3205, we're going to take a poll. So I think these are fun. Don't be shy. I'm going to launch this. There's no wrong answers. Are you familiar with the Cal-OSHA COVID-19 regulation 3205?
This is anonymous, but I will tell you that Sinead has been researching how to turn on your webcam. So if you don't take it.
We had a
Your
very
jammies will
quiet,
be visible.
we had a quiet poll once and we used that, and you would be amazed how many people started voting when that was a possibility. Haven't figured it out yet, but.
It's in the works. One of our 2021 features.
All right, so we are getting some responses. We'll give everybody a moment or so more, and then we'll share the results. All right, let's end polling. So it's about a 60-40 split. I feel like that's pretty similar to what we've been experiencing. So you're in the right spot.
Yes, definitely. For those of you who said no, we're going to give you a lot of information. Those of you who said yes, we're going to give you some tools to audit your existing program to make sure that you are in compliant. Before I get started, we have a full presentation, lots of information, as Sinead mentioned. We will try to answer as many questions as possible, so feel free to put those in the question box. We'll monitor those throughout the presentation, try to incorporate that into some of the dialogue. If you have questions that are more specific to your organization, make sure you put those in the Q&A box and we'll address those after the webinar. Before we get started, special shout out to Kevin and Greg for helping to co-host this. Just love our partnership, so glad to have a great turnout on today's webinar. So before I dive into 3205, let's talk about a letter that one of our employers received regarding alleged conditions related to COVID-19. And I want to show you this because, as you can see, these 5 bullet points, these bullet points now line up exactly with what's in 3205. So the first one about communicating trainings and safety meetings to an employee in a language they understand. In this case, it was Spanish. The second, employers not following their internal COVID-19 policies. The next one, enforcing a 6-foot physical distancing policy. The next one, installing partitions to reduce the potential direct spread. And then the last one about implementing portable high efficiency air cleaners or increasing airflow. So you can see in these 5 bullet points, Title 8, California Code of Regulations, 3203, A3, and then you've got A4 and A6. So this is the injury and illness prevention program. A3 is communication, A4 is identifying workplace hazards, A6 is correcting those. So we talked in more depth about this specific instance in a prior webinar, but I just wanted to showcase these bullet points because now you're going to see this laid out exactly in 3205. So prior to 3205 being enacted November 30th, Cal-OSHA was leaning on the IIPP to enforce, as I like to say, punish and enslave employers with regards to managing and complying with COVID-19. But now we've got our own COVID-19 regulation, which is 3205. We're going to dive into that and we'll talk about some of the highlights here in these upcoming slides. So Sinead, let's get moving. So as I mentioned, this was approved November 30th. It's a 21-page document. I don't think it's very well written. I think there's a lot of contradictory information. That is my personal opinion. Having read a lot of OSHA regulations and trying to interpret those for employers, there has been some nuances to this one that are a little confusing. I'm going to try not to confuse you anymore. But I will tell you that the CDC is also coming out with their own recommendations with regards to close contact, quarantining. We've seen kind of the reduction in time frame from 14 days to 7 to 10 days, and the ability for employers to use a negative test. That is not going to be in compliant with Cal-OSHA's COVID-19 3205 prevention regulation. So we are going to stay focused on complying with Cal-OSHA. There's going to be some additional noise coming from the CDC that might contradict what this prevention standard is. But remember, Cal-OSHA's got not only the standard now, but they've got the teeth to enforce this program. So let's go into the first 5 parts. So 3205 has 5 parts. We're going to just focus on part 1 in this presentation. But just so you're aware, the other 4 parts start with multiple COVID-19 infections, which is 3 or more cases within a 2-week period. Part 3 is the major COVID-19 outbreaks, which is 20 or more cases. Part 4 is prevention and employer-provided housing. I don't know if any of our employers are providing that now, but that's another section you would have to comply with if that was the case. And then the last part, which is employer-provided transportation to and from work. And we do have multiple employers, especially on the nonprofit side, that do provide transportation for clients and for employees. So that is another component to this new standard or new regulation that employers have to comply with. But again, we're just going to stay focused on part number 1 because there's 11 sections. So let's take a look at those here. You can see I had to wrap the text on some of these because 11 sections is a lot to fit on one slide, but I just wanted to have a 1-slide snapshot of what each of these 11 sections include. First one is a system for communicating. Remember, that was the first bullet point that we saw in that letter that went to the employer about their alleged COVID-19 violations. Number two, identifying and evaluating COVID-19 hazards. Three, investigating those cases in the workplace. Four, correcting those hazards. Five, training and instruction. If you're familiar with the Injury and Illness Prevention Program, there are 8 elements. Those 5 elements in this first part of the section line up with what the IIPP requires. We've just made it more specific to COVID-19. Number 6, we've got physical distancing. Number 7, face coverings. Number 8, other engineering controls, which includes the partitions we talked about, one directional traffic, tape on the floor that identifies 6-foot distancing. So there's a lot of examples within this regulation. I'm sure many of you are already doing that now, but now that we've got this regulation, we just need to make sure that we've updated our plan to include what we are doing in a written format, and that written format should reflect what's actually happening within our facilities. Number 9, reporting and record keeping. 10, excluding COVID-19 cases. If we have a COVID-19 case, a potential exposure, we need to exclude those employees from the work site. And then number 11, return to work criteria, which is going to be the 14-day quarantine period. We're going to talk about some details in that one here coming up. So in these next few slides, we're going to talk about some of the highlights, starting with definitions. So there's multiple definitions in this new regulation. We're just going to talk about the first 4 because these are the most important. So how do they define a COVID-19 case? That is now defined with these 3 elements. 1, a positive COVID-19 test. 2, an employee is subject to a COVID-19 isolation order. Or number 3, a person has died due to COVID-19. Now that's how they're going to refer to COVID-19 case. So when you see that term, those are the 3 definitions related to that. Number 2, COVID-19 exposure. Being within 6 feet of a COVID-19 case for a cumulative total of 15 minutes or greater in any 24-hour period. You might have seen that CDC has changed that to be an aggregate of 15 minutes over a 24-hour period. So don't get confused. It's Cal-OSHA that we're going to comply with. It's 15 minutes or greater within a 24-hour period. Number 3, COVID-19 symptoms. As you can see, this list of symptoms continues to grow. And as I've told many people, if you're hungover or you don't feel well, it might be COVID. So this list continues to expand. It seems like I saw an interesting story about a woman who lost her sense of taste, didn't have any other symptoms, but felt that because she did test positive for COVID-19 and lost her sense of taste, she thought she could see how spicy of food she could eat. So she ordered Thai at the spiciest level, and she couldn't taste it, although her eyeballs and her forehead were sweating and screaming. So a lot of kind of interesting stories coming out of this. On the positive side, we also have the other side of the spectrum, which we've seen severe cases and have had a significant amount of workers' comp claims to deal with because of it. The next one, high risk exposure period. And those are for persons who develop symptoms from 2 days before those symptoms start until 10 days after, and then 24 hours have passed with no fever reducing medication. And then the second part of that, for persons who actually have tested positive, who never developed COVID-19 symptoms, again, from 2 days before until 10 days after that specimen was first collected. So that is the high risk exposure period. You're really looking at 12 days, which is why the 14-day quarantine period is a requirement. We're going to talk about that in one of the highlights here. Okay, let's take a look at the first part of this. If you do have your exposure control plan, as we call it, it can be incorporated into your IIPP, it can be an addendum, or it can just be maintained in a separate document. We have built a significant number of exposure control plans. Some employers call it the Infectious Disease and Preparedness Plan. Whatever you might have it from a naming standpoint, it can be a standalone document. We have built COVID-19 programs for employers as standalone documents because we know at some point this is going to fade away. And if we incorporate it into our additional COVID-19, or I'm sorry, our additional safety policies like our IIPP, we're going to have to unravel that at some point. Now, that won't be for a while, but we anticipate by the end of next year, we're going to be in a much better place for this. Hopefully by summer, considering the vaccine, which you probably all saw that Margaret Keenan in the UK was the first person to take the actual vaccine in the UK. So her name is going to go down in the history books. And Tuesday was considered V-Day, Vaccine Day. So exciting news. There's some rays of sunshine coming through this crazy storm we've been navigating for the last 9 months. But nonetheless, until that vaccine is widely distributed, till we see a decrease in tests and positivity and hospitalizations and all of that, we need to keep fighting the fight. Keep your guard up, continue to implement your plan, continue to train folks, continue to disinfect, physical distancing and wearing your face covering. All of those are really critical for us to mitigate this exposure, let alone the shelter-in-place standard within California right now. Let's go to the next one here. Investigating and responding. Now, the employer shall offer COVID-19 testing at no cost to employees during their normal working hours to all employees who had potential COVID-19 exposure in the workplace. So we do know that many medical providers provide testing at no cost. Now, there's some homework for you to do, which is find either a local testing center, which we're seeing them pop up pretty frequently throughout different geographies. And a lot of those testing centers are providing free testing. Now, what is the testing? Is it the Abbott Lab rapid testing, or is it just the general test where it takes a few days, 48 hours to get your results? So that was not specified in this, just so you know, but I do encourage you to reach out to your benefits broker, talk to Greg or Kevin or the ASURA folks about what the medical providers are offering. If an employee has to go and take the test and there's a copay, you might be responsible for paying that copay. Or if they're offering that at no charge and there's no copay, you just need to provide the time for them to go take the test. And again, this relates back to a potential exposure in the workplace. This isn't just a general exposure that somebody might have come into contact with a COVID case while at a social gathering event, which they shouldn't be doing because of the shelter in place right now. The second piece, give notice of potential COVID-19 exposure within 1 business day in a manner that does not reveal personal information. Get a lot of questions around this, especially for smaller offices. If somebody has a potential exposure and Anthony goes into the office and he leaves midday and he's not seen for 2 weeks and there's a notification that goes to the employees of a potential exposure, it's pretty easy for the employees to deduce who it was. But nonetheless, we do need to keep the confidentiality aspect of this at a very high level, make sure that we're not releasing any of that information from a communication that comes from management down. Employees are going to talk, they're going to talk. You can't prevent them from doing that. Now, the interesting piece about this 3205 is, remember, it was enacted and became in effect November 30th. We have Assembly Bill 685, which is the notice requirement that employers have to submit to affected employees once they have notification of a potential exposure. That doesn't go into effect until January 1st. We're going to talk about 685 here in an upcoming slide, but with this 3205 and this notice requirement, it essentially supersedes that 685 timeline. So nonetheless, have a notice, start to prepare it. We're going to give you a framework and a tool that you can use to create your own, and just have that ready so if there's a potential exposure, you can notify affected people immediately, or at least within 1 business day, which should be immediately. As far as training, I'm sure all of you have provided training on COVID, on your policies, your procedures, available information through the FFCRA or the local health department. By the way, the FFCRA expires at the end of this month. We fully anticipate that to be extended. Whether or not that will get approved this month, it'll probably get approved next month and then be backdated. So we do know that the FFCRA is a hot topic right now, and we do anticipate that to be extended. I will tell you, having talked to various regulators and enforcement division folks over at Cal-OSHA, that you need to continuously provide training. If you provided training in July or August, it's stale. So continue to communicate as per element number 1 in this new standard. And that communication can be via email, it could be via Zoom, it could be via Slack, whatever you might be using on the technology front, but you'll have documentation that shows you've provided information to the employees. Training right now is obviously very difficult because not everybody's in a facility, so training over Zoom is okay. But again, provide information, make a good faith effort to distribute and disseminate information, and that is going to be your affirmative defense against any type of audit or compliance question. Let's keep going here, Sinead. Face coverings. This is one of my favorites. Employers shall provide face coverings and ensure employees wear those over the nose and mouth. Sinead.
Yes,
got a few people.
I know
We
someone
know.
very close to home. It's embarrassing.
Wear the mask over your nose. That's appropriate wearing of a mask. And then I love this next one. So in the top, we said employers shall provide face coverings and ensure that employers are going to wear it. But then in the next bullet right underneath it, anyone not wearing a face covering or face shield should be at least 6 feet apart unless they're tested twice weekly. So it's just kind of contradictory in my opinion. If we have to enforce it and we have to ensure that employers are wearing it, then why would that second bullet point, need to be necessary unless they're being tested twice weekly, which we know is not going to happen. So nonetheless, make sure that the employees are wearing it. Just a side note, we have a drone manufacturer whose HR manager works from home. She's received several complaints from employees that are their essential services. Their drones help deliver medical kits. So their employees, a few of the engineers notified her that says, our team is not wearing masks. We're not enforcing this. And they wouldn't give up any names, so she couldn't go and have that discussion with those employees violating the policy, and she's not there to police it. So now her concern is it's not happening because there isn't that enforcement person, such as herself, to ensure that employees are wearing it. What's going to keep those employees from calling Cal-OSHA and filing a complaint? Which, by the way, I think we're up to close to 40,000 employee complaints to OSHA about their employers' lack of COVID-19 mitigation efforts. That letter that I showed you prior is exactly one of those complaints. So we're seeing a lot of letters. We're seeing Cal-OSHA is looking to hire 60 new enforcement personnel over the next few months, predominantly to respond to this standard, to AB 685, as well as all the complaints that they're receiving. So Cal-OSHA is staffing up. All the more reason, make sure that you have a plan, and you're putting a good faith effort in making sure that that's being implemented, and you got documentation to prove it. Let's go to the next one here. Other engineering controls, as I talked about, employers shall install cleanable solid partitions. Now, I'm finding that a lot of employers are having a difficult time procuring those. So you see them at coffee shops, you see them at grocery stores. Some employers can't find them. And in that alleged letter, going back to that, Cal-OSHA was going to penalize or cite the employer for not providing partitions. Now, they did provide some, which is all that they could get. And then they created different workflows until that they could get more. And they wanted to have those partitions installed on assembly tables where employees work in four corners, but they could only find one partition, which essentially protected two, but not the other two. Think of it in terms of four quadrants. So we changed the workflows, but we had documentation of that. We had documentation of trying to procure those, and we used that as part of our response to discredit that allegation. The next one here, employers shall maximize the quantity of outside air to the extent feasible. So if you've increased the filtration system, maybe you're changing out the filters quarterly versus semi-annually, or you've increased the HEPA filter option. Maybe you're opening the doors, opening windows. The idea is to continue to increase outside airflow, so we push this mist, which is the virus, out. And so the more airflow you can create, the more it reduces the exposure. We had the same issue with the alleged letter, the alleged condition that I mentioned on the letter. The problem was that this employer is a cannabis manufacturer, and they have a manufacturing facility in downtown LA, and they're a cash basis company. So if they open the doors or windows, it poses a major security risk. So we had to explain that to Cal-OSHA over multiple phone calls and emails, saying we can't increase outside airflow by opening our doors or windows because of the security risk to our organization. But they did have an enhanced HVAC system because they are a cannabis manufacturer of editables, and because of their GMP, they had to ensure that no particulate was in the air that could contaminate the actual product. So nonetheless, we had to build all that story and then draft that letter and respond to Cal-OSHA within 5 days, because that's the requirement when you get those alleged condition letters now, is gather the documentation, write the letter, discredit each one of those allegations, and then hopefully through that process and through your efforts, you're going to mitigate the exposure, which is exactly what we did. Cal-OSHA closed the investigation within 3 weeks. No further investigation was completed, which means no additional audit, citations, penalties, let alone it's public record, and it also can be reviewed by underwriters during the renewal process of your workers' comp premium. Let's keep going here, Sinead. Exclusions, as you well know, we want to exclude anybody in the workplace who's tested positive for COVID, or anyone exposed to COVID-19 must also be excluded for work for 14 days. And that's a tough one considering the spike in cases, because in theory, we're only a few degrees of separation from somebody who's tested positive. So the exposure rate is exceptionally high. And a lot of this is built on the honor system and thinking that the employers are going to tell us if there's a potential exposure, and then they're going to quarantine for 14 days. And while they're quarantined, they can still work if they can work remotely. So that is a question that comes up quite frequently. This next one, bullet, employers must continue and maintain an employee's earnings, seniority, and benefits. This is getting a lot of pushback from different labor unions. It's a very difficult one to comply with. We don't have all the answers. I encourage you to reach out to Greg, Kevin, the ASURA team, to us, your employment law attorney, or your HR team or consultant to get more guidance on that, because that is a very tricky one and it's employer specific. Let's go to the next one here. Return to work. This is an interesting one. So workers with COVID-19 shall not return to work until at least 10 days have passed since symptoms first appeared and at least a day since a fever of 100 degrees Fahrenheit or higher has been resolved. Those who have tested positive for the virus but have no symptoms shall not return to work until at least 10 days have passed since they first tested positive. So before we said that they have to quarantine for 14 days, but now here it's at least 10 days have passed since symptoms first appeared. So the 14-day quarantine period is still in effect. If somebody is exposed or tested positive, they have to quarantine for 14 days. The tricky one is this 3205 C11C. A negative COVID-19 test shall not be required for an employee to return to work. We've had various employment law attorneys say, we'll try to get the employee to have a doctor sign off that they're no longer positive or symptomatic, which is really difficult considering the increase in hospitalizations. So nonetheless, as an employer, you cannot require that a negative test be provided in order for that employee to return to work. But I will tell you, throughout this entire regulation, there are several sections that talk about making sure that you keep tests confidential, making sure that you go and have the employee get tested. Well, if we don't require a negative test, then why do we have to worry about keeping tests confidential? Because we shouldn't be obtaining those anyway. So there's a lot of conflicting information in this regulation, but nonetheless, this is the standard that we have to comply with. So if you have any questions with this, I encourage you not to go down to too many rabbit holes and what if scenarios, but if you have a specific exposure or a potential case, we can work with you on the decision tree analysis to get to that result and what you need to provide to that individual employee or to those that might have been affected. To help you along your COVID-19 exposure control plan journey, we have actually taken the entire first part of this regulation and we dissected it in the 11 sections and we put each subsection in the form of a question. Sinead's going to be putting this in the chat. So I encourage you to take this checklist, work with your team, cross-reference against your existing exposure control plan. And I can tell you, having completed this with multiple employers, each employer maybe had 2 sections they needed to update in their written plan. It was very minimal. And it's everything that we have been trained on, that we've been talking about for the last 9 months, everything that you've heard from different sources. So I assume that most of your exposure control plans are going to be significantly compliant. There might be a few modifications that you need to update, but most importantly, use this checklist as your North Star to navigate through the compliance aspect of this new standard. If you have any questions with that, be sure to reach out to Kevin, Greg at ASURA or ourselves over here at ESM to help you navigate through this. Also, I talked about training. If you haven't provided training in the last few months, here's another acknowledgement form. We provided this in the last webinar as well. It's in English and Spanish. I encourage you to use this or something like this. You can see the top portion is acknowledgement by the employee that they've been trained on all things COVID-19. They have a responsibility themselves to self-assess, stay home if they're sick, wear their mask, keep their distance, avoid touching their mouth and nose, and all of those components. And then the next section, the third part down below at the bottom, is if they've tested positive, what they need to do. So I encourage you to use this form, again, English and Spanish. Feel free to modify it. You're not going to hurt our feelings. Continue to train your employees about this virus. And then hopefully over the next 2 months, we're starting to see some relief with the vaccines being rolled out, which is, I can't tell you how very exciting it will be when this is all said and done. We've already started pre-planning our parties, to say the least. Let's go to the next one. All right, let's briefly talk about AB 685. Sinead, do you want to jump in here?
Poll. Yes. So another poll, which I think is fun, and it's a great way for us to get a pulse on where everyone's at. Have you prepared your employee notice required per AB 685? So let me launch this and just vote and let us know.
And as a reminder, this is It goes into effect January 1st, but with 3205, we basically just fast track the notice requirement. So if you haven't prepared it, which we're going to see here in a second, who has and who hasn't. Again, it's anonymous, so don't be shy.
No wrong answers. All right, so we'll end polling now and I'll share the results. So it's about a 70-30 split, and mostly
Okay.
no.
All right, and this is what we see pretty typical, in the different webinars we provided. So I encourage you, we're going to give you a sample form that you can use. Let's talk quickly about what 685 is. Basically, the essence of it is if you get notification from a qualified individual, and a qualified individual means somebody who's got a COVID case, as we defined in 3205, and there's a potential or a realistic possibility that employees interacted with that person could have been affected, the employer has 24 hours to send notice to those affected individuals of the potential exposure. If the employer does not, Cal-OSHA under 685 and their expanded power of authority can issue a citation, a serious citation, which can start at $18,000. So it's very important if you get notification that you provide this notice to employees. There's certain requirements of this notice. You can see it can be sent by email, text, phone, but you want to document that you've sent it. So if you are sending it by phone, which I encourage you to do it from a text or a written standpoint, very important to track that. And that's going to be, again, your defense against any OSHA issue. Under 685, an outbreak is considered 3 or more cases within 2 weeks. Not to be confused with Senate Bill 1159, which is when you report the COVID case to the carrier. That is 4 or more cases. 4 more cases are considered an outbreak when reporting under the workers' compensation realm. So a lot of confusing information. Local health department, Cal-OSHA says 3+ within 2 weeks. 1159 says 4+ under the workers' compensation sector. So if we could just try to make this more confusing for employers, I think that would probably be beneficial to no one. So Sinead, let's go to the next one here. Here are 4 things that actually changed. As I mentioned, Cal-OSHA's got expanded authority. They have the OPU, which is odor prohibiting use. If they find that an employer is not compliant or putting a good faith effort in mitigating the exposure, they're not notifying employees of the potential exposure within the 24-hour period under the 685 or 3205, they have the authority to shut those organizations down. They can issue that citation. There's typically a 15-day response they provide to employers. In this case, that is not the case. So we need to ensure that, again, we're making a good faith effort so that we can avoid these potential serious citations and violations. As I mentioned, under the 3+ COVID outbreak scenario, you have to notify the local health department and Cal-OSHA, who will follow up with you with additional questions. So those are the 4 things that changed with 685. A lot of that is intertwined into 3205, the new regulation. So nonetheless, have a notification. Here's an example, Sinead. Let's show them that. Here's a sample form that you can use. We'll put it in the chat here. Again, this is not something that you can put your logo on and copy and paste and send out. It is going to require some homework. There are certain requirements under 685. We had a whole 685 and 1159 webinar. Prior to this, it's on our website. I believe ASURA has it as well. I encourage you to watch that. There are certain nuances to each one of these new bills. But most importantly, you have to identify what your sick policy, PTO policy is, what FFCRA is offering, assuming it's going to be extended past December 31st. There has to be a non-retaliation clause in this letter. And then also on the 3rd page, you can see there on the right, you have to outline your COVID-19 mitigation strategies or practices. Now that you've gotten notice of an exposure, what are you doing to disinfect, quarantine, and prevent that from reoccurrence? So this is just a framework you can use. I encourage you to, again, debrief with your team, take the 3205 audit checklist, take the 685 notice, start to get your plan in place, and just make sure that, again, you're moving forward in continued implementation and training under these new regulations. So as a reminder, remember this. If you have a COVID case and it's work-related, you have to notify the carrier using the DWC-1 form. It's a work-related injury. If you have a potential exposure that might be work-related, you still have to notify the carrier of that potential exposure, but you have to keep that person's information confidential. Most carriers, in fact, all carriers have a form related to this now. If you don't have it, reach out to Kevin or Greg. Make sure that your carrier form is provided to you so that you do notify the carrier of that potential exposure. They need it for contact tracing. And they also use it in case there are 4+ cases, which is considered an outbreak. They need to know that specific location on where that outbreak occurred. There'll be other requirements after that. The other piece of it is, and Abe on our team has a great way of explaining this. In the spirit of the law, if you have knowledge about a potential exposure or something that could impact other employees and you withhold that information, that is not going to go over well. So in the spirit of the law, be transparent. You have a moral obligation to provide information to employees so that they can make a decision. Hector Alvarez, who's going to be on our January webinar, he specializes in mental stress and behavior threat assessments. And he had a great analogy that we are all in this storm together. It's a global storm, but each one of us is in our own boat. And we just don't know what each boat entails. And so it's very important that you provide employees information if you have information to share. Withholding that is not going to be looked at lightly by any authority. Let's go to the next one. Travel guidelines. So obviously we've got a very strict shelter in place. Prior to this last week's order, California Department of Public Health said no more than 3 households can get together. Now it's no households can get together, just stay within your bubble, don't travel, only essential services or essential needs should you be leaving your house. But for those of you, and I love to share the story because Sinead is Italian, as is my wife. Number 7, if you plan on singing, chanting, or shouting strongly, we encourage you to do it outside and with a face covering.
Or having passionate talkings or discussions. It's all about
Yes.
that.
Add some vino to the mix and that level goes up quite a bit, right, Sinead?
Of course, and dancing.
Dancing. Yes, can't forget the dancing. Just do it at a distance. So here are some additional information about travel guidelines. We put together these recommendations. Go to the next slide here. Might be a little bit of a delay. So here are some travel guidelines. Again, another form of communication to your team. Obviously, shelter in place is most critical. You can't prohibit your employees from traveling. And if they're going to travel, we want to make sure that they keep their guard up. And we provided some personal travel tips curated from various agencies, CDC, various hotel chains, the TSA, and then we've also added some of our own travel guidelines. So again, I encourage you to take a look at this, communicate with your staff. It's just another form of communication under 3205, which is really important. Sinead, let's go to the next one. Here are some additional training tips that, again, you can use in communication. We put together our own ESM safety tip of the month, which was holiday travel. The CDC has their own recommendations on what to do during the holidays. And then, of course, the TSA. You know what, Sinead, I just realized that link for ours is incorrect. So we'll update that. The TSA, what to know before you go. So again, just a little pictogram or an infographic that you can share with your employees. If they are going to travel, we encourage them not to, but if they are going to travel, they just need to keep their guard up, and here's some guidelines for that. Okay, so that was the doom and gloom fun stuff related to 3205 and what's happening within the regulatory requirements throughout California. Let's talk about how we're gonna move forward. I can't tell you how excited I was to see that clip about Margaret Keenan being the first person to be vaccinated, at least in the Western world. It was just a bit of relief, especially after my wife just showed me photos. They went to a playground and we're kicking the ball on the soccer field with our 2 little girls, and she showed me photos of a playground where all of the swings had been chained up. There's construction tape wrapped around all the playgrounds. A lot of signs saying you can't be here. It was a stark reminder of how real this is. And most of the time we don't leave our home, so we don't see it, but to be out there and to see that was depressing, to say the least. And so a bit of sunshine coming through this open door, as we can see here, with the vaccine starting to be rolled out, especially in the UK. We anticipate approval this week from the FDA. Canada just approved it. So it's going to happen. It's coming. So there is relief in sight. Now, what we want to talk about is how do we get back to the new normal, right? We're going to have to be very vigilant of COVID, obviously, but I've started to have a long list of conversations with employers about developing their safety program and what that looks like after this, as they bring people back to work. as we still have those safety absolutes, as we call them, which are our safety loss leaders, our safety exposures related to our facilities. What is our plan to continue to manage the exposures and mitigate those so that we don't have a workplace injury or incident? So here's an example that I'm going to go through an example of a case study that we had with an employer to give you an idea of what that looks like. This employer had an XMOD that was increasing about 89 points above 160 over the last 5 years, and work comp premiums were going through the roof. And so they realized that they needed to do something different because what they were doing, which was not much, was not working. So we put together this framework. It started with these first goals. One, we want to establish a monthly safety committee. That safety committee is going to establish goals on reducing injuries and exposures. We're going to use data to determine where our losses are so that we can focus on those loss leaders. We'll develop Cal-OSHA compliance goals and injury reduction strategies based on standardizing policies versus what those Cal-OSHA standards are. Remember, the more you can standardize, the more you reduce variation, which means the more you reduce risk. From understanding what our loss leaders are, from the data that we're looking at, we want to develop relevant safety training that's focused on reducing those loss leaders. We needed to develop an employee safety handbook. We were hiring quite a bit. And so bringing people into the organization, we wanted to start with an administrative new hire onboarding process, going through our employee safety handbook, which included our IIPP, and then getting them out to their department, where we started to develop job safety analysis and specific training relating to the equipment or the service that they were going to be providing. And then we also wanted to recognize and reward employees that went above and beyond the safety program, especially during COVID-19. I'm sure you have many employees who've stepped up and have contributed so much more during this pandemic. And so we wanted to recognize them through a safety recognition program. So let's go through some of the details of this. So this company, we established a 3-year plan to lower workers' compensation costs. They wanted to continue to expand. This is a large property management company in Los Angeles. Very big geography, lots of maintenance folks going to different properties, lots of resident managers. They have a large administrative office of 100 plus people. And so they wanted to grow. And in order to do that, they didn't want to continue to, they wanted to continue to reduce their expenses, especially related to workers' comp. The more we could save on workers' comp, the more we could reinvest that in benefits, hiring, as well as our growth strategy. We recognized that they wanted to reduce their XMOD, but when we talked to the managers and supervisors, nobody knew what the XMOD was. So we had to start with education on what the XMOD is, which is another word for employer experience modification rate, EMR. For those of you who are confused on what an XMOD is, it's really your credit score related to your safety program and your workers' comp program. We wanted to make sure that we train those folks on how they can have an impact on reducing and controlling it. We wanted to leverage data because we had enough claims and injuries and history to identify where key exposures were and what those loss leaders were. And then we wanted to implement various technology resources so that we could implement an organization-wide plan. We had maintenance folks that were leaving their house going straight to job sites to conduct whatever work order was assigned to them. So how do we train folks that are spread all over across Los Angeles County on a monthly basis without bringing them all into a facility? That was going to be cost prohibitive. And then also, we just wanted to start to write a new story. And that's really what we came away with in the first meeting is we need to author a new story because the story we are writing now is not working. And this new story is going to be based on these specific needs. We've aligned those needs to the corporate goals and strategy, and now we have an enterprise risk management program. Let's go through some of the details. So I encourage you to use some of these exercises we're going to talk about here. A SWOT analysis is a great way to start getting alignment within your organization, strengths, weaknesses, opportunities, threats. It's probably more easy to identify the weaknesses, but if you do this every 6 months and you line this to your plan, I can guarantee you in 6 months' time, those weaknesses will become strengths, and you're going to start moving the needle more effectively on administrating your safety and workers' comp program. As far as threats, who would have ever thought in their wildest dreams that a virus would impact the entire world this year? So hard to say that we can identify all threats, but we do know Cal-OSHA compliance and the new regulations is a certain threat. So we want to make sure that we're enhancing the foundation of our compliance program, starting with COVID-19. Sinead, let's go to the next one here. This is another great exercise. So we start to understand the strengths and weaknesses. We're starting to get buy-in and alignment within our safety committee. Where are we at on the risk maturity spectrum? This is a great way, again, of starting to get alignment within the organization on goals and strategies and where you're currently at, and then how you're going to get to the next level. So we'll just go through these really quickly. The first one is ad hoc. Our organization uses the risk management process more on a transactional basis. Something happens, we fix it. Number two, we're starting to implement a risk management framework. We're starting to recognize where our losses are. We're starting to understand the risk and how it affects our organization. Three, we're starting to implement strategies. We're starting to repeat those. Our departments, our business units are starting to implement that into their strategy. It could be construction, could be manufacturing, could be ag, could be trucking. You're starting to recognize where the exposures are, and you're starting to have a repeated process and implementing initiatives to reduce those exposures. Number four, manage. We're really skillful in starting to identify risk, put together targeted plans like our 2021 risk management strategy. And then level five, we've embraced it throughout the organization. We've achieved a participatory culture where everybody is participating in the program. We've developed standard operating procedures or job safety analysis, intertwined that into our workflows, and safety is built into the organization. It's not a standalone program, it's integrated into the processes. I can guarantee you, I've worked with many companies through this process, and when we get to that leadership level, the company is operating so much more efficiently. There's specific plans and processes and work orders and structure, and the efficiency levels go up. The meetings efficiencies go up. The identification of risk goes way up, and the reduction of exposures and injuries goes way down. Sinead, let's run another poll.
Do another poll. This one is a wordy one, but let's get everyone's gauge on where they're at. Let me just launch this. Here we go.
Again, don't be shy. It's anonymous unless you don't answer. Then we're going to call you out.
So where's your organization on the risk maturity spectrum? So level 1, 2, 3, 4, or 5? Okay, we have
just give you
a few moments. Remember, we can turn cameras on.
Yes, we're watching you.
Force those answers.
Kevin, I see you not answering.
All right, we'll give everybody just a few moments.
All right, let's see where we're at here.
Let's see. Here we go.
Okay. All right. The person who marked number 5, excellent job. Number 4, excellent job. I would say the majority of organizations we work with usually fall in the 2 to 3 level. And obviously this totally depends on size, exposure, sector, all of that. But nonetheless, now you're starting to understand, and I know that you're thinking about your strengths and weaknesses, and now you're thinking about where you're at in this risk maturity program. So pick 4 initiatives next year for 2021. I've got 6 examples here. Those 4 initiatives are going to help you move to that next level. And this is where you really start to get alignment within a safety committee or just your safety program. You did the exercise about SWOT. You've come together on an idea of we're at level 2. We need to get to level 3. Okay, as a committee, what's it going to take to get to level 3? What does that look like? Is it reducing injuries? Is it increasing training? Is it enhancing our onboarding process? Is it managing COVID-19? Whatever those initiatives are, be excellent at them. So if you pick one a quarter and you exhaust every aspect of it, you're going to be smarter about administrating the safety and work comp program. And the more you communicate those programs, those goals to the organization, the more alignment you'll get across the entire company. So let's keep going here, Sinead, so we can get them out on time. So, when we look at data, we look at a lot of different size employers. We have clients that have 10 claims. We have clients that have 200 claims, workers' comp claims. And so there's a lot of data that we can pull out of that. So we have 10 different categories and 29 different data points that we look at to help us understand the risk portfolio of a customer. Things like lag time. We have 5 days to report an injury. Not reporting an injury on time reduces timely medical treatment. And there's a correlation between the lack of reporting a claim on time, that claim becoming an indemnity claim or a lost time claim, and that claim becoming litigated. And so the faster we report claims, the faster we get those employees medical treatment, the faster we get them healed and back to work, which reduces the indemnity and the litigation exposure. So those are some examples. We also look by department, by location, time of day. If you have a lot of injuries that are happening on Monday, those are red flags, especially when you know that some of your workforce plays soccer over the weekend and they come in Monday morning and they claim a twisted ankle. So lots of different data points to look at to fully understand your portfolio of risk. Here's just some examples that you can use. Again, depending on your size, again, just a benchmark that you can reference. So this is a sample page from one of our claims management reports. We look at the XMOD, the years that are impacting the XMOD, which you can see 2019, 18, 17. This company hired us in 2019 to put together a safety program. You can see they're averaging about $227,000 in claim costs in 18, 17, 16, with an average of about 11 claims a year. And then they were having roughly 4.5, 5 indemnity claims a year. So we're starting to understand just kind of big picture data. Let's go to the next one. And so now what we want to start doing is driving goals. Okay, if we're averaging X number of claims or X number of claim costs, let's reduce that by 25%. What does that look like? So if we're averaging 100,000 in claim costs, we want to reduce that by $25,000, 25% this next year, then we need to back into that on a month-to-month basis, and that becomes our KPI. I'll show you a dashboard on how to do that. So here we set some goals, 7 injuries or less. We're training employees, but are we really training them? And so we want to make sure that we're measuring that training. So is 90% of our staff getting trained, or is it 50%? We want to have safety committee meetings. We're going to provide training at that safety committee to make those safety committee members smarter about going out to their departments and administrating the program. We want to report all injuries on time. We want to have a reduction in lost days, which you track on your OSHA 300 log. And then you also want to reduce your overall claim costs. In this case, it would have been the lowest in 5 years. So let's show you some results. So here we are. This is a full year of development. We achieved our frequency goal. We more than achieved our severity goal. We reported all injuries on time per our 75% goal. If you saw, I had 100% on that last one. We changed that to 75% just because we recognize that there's always going to be those one-off anomalies. So we reduced that to 75%. We trained 95% of our staff, which we measured, and that was also skewed in April due to COVID. And then we had 15 lost days versus our 25 goal. So Sinead, let's move to the next one. And here's the overall results. So we reduced frequency by 46%. We reduced severity by 85%. All workers' comp claims were closed in that year for the first time in over 10 years. That was a big achievement. We had fewer indemnity claims, fewer indemnity costs, and even though they had an XMOD of increasing by 89 points from 76 to 165 in that 5-year period, Everest, the carrier, because of this story, remember we rewrote the story, they gave them a $50,000 discount on their workers' comp premium. So because the XMOD is a lagging indicator, we looked at leading indicators and developing those monthly KPIs to track that. And that was the result. This is why it's so important to have a good safety plan. It can be used not just to reduce injuries, the human element side, it's also good business. And working with Kevin and Greg, writing the story, they can take your company to market, or they can negotiate with the carrier for discounts based on these types of objective results. Here's a template that you can use. You're going to get these slides. I encourage you to use this. Let's go to the next one here. We'll keep moving because I know we're running out of time. If you don't have a safety committee, perhaps that's one of your initiatives for 2021. If you do have one, maybe there's an opportunity to enhance it. Here's just a high-level overview of what a safety committee looks like and how we distribute information from the governance committee all the way down to the employees. But we also want the employees to participate as well. If you haven't gone through your own compliance audit, we've prepared a safety compliance checklist for those customers that are in our Insight portal. All of this is available in there. I encourage you to use this as, again, a guidepost on what are you missing from a compliance standpoint, what do you need to shore up. Remember, 60 new enforcement officers within Cal-OSHA across California, so they're on the hunt. And COVID-19 allegations are just opening the doors for enforcement officers to come in and put their eyeballs on a swivel to look for other exposures. Again, for our Insight customers, and for this company in particular, we developed 12 learning plans that were related to exposures and policies that we wanted to get those safety committee members up to speed on. So understanding my XMOD Part 1 or Part 2, or understanding Cal-OSHA's injury and illness prevention program. How do we establish an effective safety committee? Litigation strategies, because they had quite a few litigation claims, which we didn't have any in the year that we had implemented this program, which is a big win. For each one of these trainings, there's a certificate and a badge. And I will tell you, for Insight customers, if you take 4 trainings, Sinead will bribe you with a $20 Amazon gift card.
It's all about bribery.
We love bribery. All right, let's go to the next one. If you don't have a training program, here's just some ideas. Put together your annual program. Here's the trainings we want to focus on that are related to our exposures. Develop a one-page safety tip. We've got a ton of them as well. There's plenty available out off the internet, but just use a one-page tailgate training as your training. It doesn't have to be an hour-long training unless it's a workflow or specific standard operating procedure. But the idea is to just keep the awareness of safety and keep the awareness of the exposures that impact your organization at a premium. More people are aware of those exposures, the more they'll make the right decision when faced with them. We talked about the employee safety handbook. I'm going to go through these last few slides so I can give Sinead and Greg just a few minutes here. This is an example. Take your IIPP, your code of safe practices, bundle that together into an employee safety handbook. You can use this for onboarding at the new hire orientation, the administrative level, and you can also roll it out annually to all employees like you do with your HR handbook. It's a great way to comply with about 75% of Cal-OSHA's training requirements. If you're doing site inspections, measure them. I mentioned that we talked about technology. JotForm and GoCanvas, those are two online applications. They're very inexpensive. There's a free version. You can actually build your own inspection checklist. You can use your smartphone, take photos, complete the inspection, click submit, and that'll send a PDF report to yourself or anybody else who needs to receive that. So again, using technology to digitize as much as possible will help reduce the paper tiger that you're creating with your safety program. And I mentioned the safety recognition program. Here's a sample of a safety award. Recognize those individuals that step up. Give them a reward. Give them a $20 gift card. Share that information with the organization. That's where you get the participation and the buy-in. It's not just a top-down. It's, hey, we want to recognize those that step up and help our organization to become more safe. Keep our people safe. Keep our costs down. And then once you've developed your plan, I know I'm going through this kind of quick, here's a Gantt chart. You've identified you're going to have safety committee meetings, you're going to do trainings, inspections, maybe you're doing your XMOD projection with Greg and Kevin mid-year of your policy year. We're going to develop that storyline, that stewardship report to the carrier. We have a safety recognition program. You can see the list here. Put together a Gantt chart of what you want to achieve each month. And then you meet with your safety committee, you can check off as we've done here. Each one of those becomes green that we've achieved it. So now you're moving the needle all through the year. And when you look back after what you've completed, it's going to be impressive. You're going to be smarter about how you manage the safety program for your organization. For our Insight customers, we actually have TaskRay, which is our own internal tracking system. We're going to be making this outward facing for our customers so that they can see how we're tracking through all the deliverables throughout our customer journey. And lastly, employees have to be committed. They need to report all injuries, no matter how minor. They need to participate in training. There's other various tools you can use to measure and manage that, but there needs to be a commitment, not only from management, but the employees as well. And Sinead, I tried to give you more time, but I just kept talking.
A lot of great content, a lot of great information, well worth it. So I will be conscious of time and go over these really quickly with you. So Insight is a subscription portal that we have available for our clients. So definitely reach out if you have any questions. There's going to be a lot of exciting changes coming up for 2021. TaskRay, like Anthony was saying, is going to be there for our clients to see if we're doing claims management with them or a safety program. For claims management clients, we'll be able to see the claims at a glance, as well as new learning plans. And then we will be showing our new webinars on our Insight portal for clients to see as well. We do have a great webinar coming up January, the beginning of the year, 2021. Still can't believe it's almost 2021 almost. But this is with Hector Alvarez, and he's a partner of ours, and we're going to be looking at workplace crisis intervention, really honing in on all the stresses that employees are going under, especially during this time frame right now. So making sure that their mental health is at the best that it can be, so that we can ensure safety throughout all of our organizations. So this one is coming up. Keep an eye out for that. It's going to be a good one. And of course, we're here to help. So definitely reach out to ASURA Risk, Kevin and Greg, as well as our team if you have any questions. The resources that we shared with you today are just the tip of the iceberg of the resources that we have within our Insight portal. This is just a nice snapshot of our COVID-19 library. So we have tons of libraries with lots and lots of different resources that you can use as a framework to begin to create your programs, documents, or use them to do almost like a gut check on what you have created already. But with COVID-19, we have everything that you would need and more, and we're going to continue to add this as we go through and navigate this pandemic journey and all the new changes, regulations, those types of things. We're going to continue to create those resources and content so that you have everything and more. For our ASURA Risk clients, we do offer our Insight Portal at a discount. So right now and through the end of the year, this is the price. It's a yearly subscription. You'll have full access to all that we've talked about today, plus more learning plans. You have a library that has 1,500 plus resources, not only our COVID-19 library, but much more, especially if you were wanting to create that safety committee. All of that resources that Anthony was talking about are going to be in there for you to implement it yourself. And with that, I'm going to turn it over to Greg to close out for today. But before I do, on behalf of ESM, thank you so much for your time today. And Greg, it's all yours.
Yeah, thanks, guys. I appreciate it. You know, we want to respect everybody's time, and it looks like we are right at 11:30. So again, a lot of information, lots of questions. I know it appears that it's overwhelming. Please feel free to give any of us a call. Kevin and I are more than happy to help set up calls with ESM and help you guys build a plan going forward. So again, thank you ESM, Anthony, Sinead, and Sarah. Kevin, John, and I are all available after this call, and please be on the lookout for a survey. Let us know if you have any additional questions. Again, happy to help and support in any way we can. Thanks a lot. Take care, guys.